I'm Valerie Benjamin. I'm the Assistant Vice President of Human Resources here at St. John Fisher College, and I'm here with my colleague, Kathleen Maurer, and we're going to be talking for the next 20 minutes or so about the HERO Act training for COVID-19. First of all, the purpose of the Act. The New York Health and Essential Rights Act, or HERO Act, was signed into law on May 5th, 2021. It provides extensive health and safety protections in response to the pandemic to protect employees against exposure and disease during a future potential infectious disease outbreak. The law also mandates that employees have access to specific training, like this, on the disease and the exposure protection plan in place. Throughout this training, Kathleen is going to talk a little bit about the disease itself, and then I will later in the presentation talk more about the plan and the employee rights under the Act. Please take it away, Kathleen.
Thanks, Val. Okay, so COVID-19. The World Health Organization first learned of this new virus on December 31st, 2019, following a report of a cluster of cases of viral pneumonia found in Wuhan, China. Among those who develop the symptoms, most will recover from the disease without needing hospital treatment. However, 15% can become seriously ill and require oxygen, and 5% can become critically ill and need intensive care. Complications leading to death may include respiratory failure, acute respiratory distress syndrome, sepsis, shock, and multi-organ failure, including injury of the heart, liver, or kidneys. In rare situations, children can develop a severe inflammatory syndrome a few weeks after infection. Here are some of the signs and symptoms of the disease. Some of the most common COVID-19 symptoms are fever, dry cough, fatigue, persistent pain or pressure in the chest. Some other symptoms of the disease that are less common, which I'm sure you've heard most of, include loss of taste or smell, nasal congestion, conjunctivitis or pink eye, sore throat, headache, muscle or joint pain, different types of skin rash, nausea or vomiting, diarrhea, chills, or dizziness. There are some severe COVID-19 symptoms, and this includes shortness of breath, loss of appetite, confusion. All right, and the COVID-19 disease can be spread in three main ways: breathing in air when close to an infected person who is exhaling small droplets and particles that can contain the virus. Having these small droplets and particles that contain the virus can land on your eyes, nose, or mouth, especially with splashes and sprays like a cough or a sneeze. And then touching your eyes, nose, or mouth with your hands, which can have the virus on them.
Now that we have reviewed the disease itself, let's talk a little bit about an explanation of the exposure and prevention plan that we have here at the college. The purpose of it, as we've stated, is to protect all employees against exposure and disease during an outbreak. This plan will go into effect when an airborne disease is designated by the New York State Commissioner of Health as a highly contagious communicable disease that presents serious risk or harm to public health. The plan is subject to additional or greater requirements arising from a declaration of a state of emergency during an airborne infectious disease, as well as applicable federal standards. And our governor has activated this prevention plan for COVID-19. The plan applies to all employees as defined by the state act, which means any person providing labor or services for remuneration, including part-time workers, independent contractors, and other temporary workers. Importantly, this plan applies to all employees, including the student employees at St. John Fisher College. So what are some of the activities and work locations that may involve the exposure to the infectious agent? So in this case, obviously with COVID-19, all areas on campus where people can interact are subject to some level of exposure. However, the St. John Fisher mandatory vaccine policy and mask protocols do provide protection against the infection and spread on campus. In addition, we've set 4 operational levels: yellow, orange, red, and gray, in response to the pandemic. These are monitored using several indicators, including the number of COVID-19 positive cases, the level of community transmission and spread, surveillance of COVID-19 in our wastewater, and the isolation and quarantine capacity on campus. And as always, changes in operational levels are communicated via email from Fisher Alert and are also available in the COVID section of our St. John Fisher College website. So in talking about the uses and limitations of exposure controls, which is another required element of the training, based on CDC guidelines for institutions of higher education, on a fully vaccinated campus, which is what we are, should an actual or suspected disease occur, we'll take the following actions. First, employees will monitor symptoms, and should you be symptomatic, get tested for COVID-19. If an employee has come into close contact with someone who has COVID-19 or is tested positive, they should get tested 3 to 5 days after the date of exposure and absolutely wear a mask in public indoor settings for 14 days after the exposure or until receiving a test result. Currently, we have an indoor mask mandate. Anyway, close contact is defined as someone who is less than 6 feet away from an infected person for a cumulative total of 15 minutes or more in a 24-hour period. Employees do need to isolate if they have tested positive for COVID-19 in the prior 10 days or are experiencing symptoms. If you have symptoms, stay home. Employees with a vaccine exemption are required to mask indoors and always follow social distancing recommendations. And as always, we will be following applicable federal, state, and local laws and regulations. Finally, I'd like to go over a review of employee rights provided in the Act. So in keeping with our zero tolerance policy on retaliation, the college will never discriminate, threaten, or retaliate or take any adverse action against any employee for exercising their rights under this plan. This includes reporting any conduct that an employee reasonably believes in good faith violates the plan or airborne infectious disease concerns. And a confidential COVID concern report, as always, can be made at any time by accessing the COVID-19 resources page on the St. John Fisher website.